What's up, everybody? Welcome back to another episode of Trading Brains. I'm your host, Evan Greif, here with my co-host.
Oh, what?
My co-host. This happens every time. You know what? Let's just make it so that
Why can't we get this right?
Right.
No.
Yeah. Let's do
Okay,
it again. Let's do it again. Let's do it again. All right. I'll just cut this part out. Right. We're professionals. We've been doing this for a very long time, as you can tell. Hey, everybody. Welcome back to Trading Brains. I'm your host, Evan Greif, here with my co-host, Angelo. You can find us on Twitter at Trading Brains and also on Instagram. And if you have content suggestions or if you want to complain to us about our show being so poorly done, or maybe you even have some positive feedback, right? Email us at tradingbrainspodcast@gmail.com. Thanks for listening, and we're going to get started with today's episode. Today's topic is very topical because we're going to be talking about coronavirus. Yeah, coronavirus. Probably everyone and their moms are talking about coronavirus, and we decided to jump on the bandwagon, right?
Yeah.
And that's
why not?
Because I mean, it's something that's really related to everyone's lives. And since I live in Tokyo and Angelo's in New York, and we know about how it's going in different geographies, different locations, we thought it would be an interesting episode to do. So, bring it in, like, okay, what is coronavirus? If you don't know what it is, obviously you've been living under a rock, but it's a respiratory virus, and it's unlike anything we've seen before, and we really don't have any vaccine available for it right now. And that makes it, very dangerous for the general public because you either survive it or you don't. So basically, like, some background information is at the end of December, the World Health Organization, WHO, was informed of an outbreak of pneumonia-like cases in Wuhan in the Hubei province of China. And these first cases, some of these people showed symptoms like maybe 7 or 8 days later, December 8th or so, were actually people who were working in a South China seafood market in Wuhan. And so that's why a lot of people have been saying, this disease is developed from sales of this animal wildlife. And some people are saying, it could be bats or something like that. I don't know about all that. Maybe that is the case, but either way, the WHO quickly found out that it was a novel virus and that we had no cure for it. And so later on, maybe like 2 weeks after that, there was the first international case, so a case outside China in Thailand, and outside of Wuhan itself, still within China, in Guangdong and Beijing, on January 19th, there were confirmed cases. On the 20th of January, they had confirmed infections in Japan and South Korea, so pretty much the Asian region was starting to spread. And then even on the 21st of that same month, in the U.S. and Taiwan, there were detected in travelers coming back from Wuhan. So that's basically kind of an intro to coronavirus. But Angelo, could you talk a little bit about coronavirus itself?
So, thank you for the lovely intro about this fatal disease. It's any other illness that we had experienced before. We have experienced MERS in the Middle East, respiratory syndrome, severe acute respiratory syndrome as well, SARS, common cold. It's a very flu-like virus. COVID-19, it was declared by the WHO and it was before it was known as SARS-CoV-2. So they kind of want to make it into a new area, a new disease, so they call it COVID-19. So when they're constantly monitoring this disease, this illness, and trying to see what was going on. Normal symptoms that I had had the flu, fever, cough, and shortness of breath, difficult breathing. And it appeared anywhere from 2 to 14 days after being exposed. the one thing about this disease that people do get worried about, you could be asymptomatic. So you could have the virus but not show any of this. You'd be just as anyone else, as healthy as really healthy. So like when you're walking out, going to the supermarket, you might have it, but you don't even know it because you're not showing these symptoms.
Mm-hmm.
So
That's what they call silent carriers, right?
yeah. So other symptoms that you could have: tiredness, aches, runny nose, sore throat. Some people actually also, which is weird, and I do find this actually really interesting, that people are experiencing a loss of smell or taste. So
Yeah, and I heard about that too, and I wasn't sure if that was like a small number of people or just something that hadn't been explored
I think it's
early on.
just it hasn't been explored, and I think now it's just new experiences going on because since it is a respiratory, it does kind of like with your breathing, so you can't certain receptors in your from your nasal cavity to your lungs are basically being compromised, and they
Right, right.
manifest in your lungs.
Okay.
So anyone who has like certain like previous pre-existing illness are at high risk, like heart disease, lung disease, diabetes, or who has a
Hmm.
comprised of immune system, like if they're compressed. So, or because this is very similar than influenza. So, how can you treat it? There's no antivirals. It's just a virus. There's no antivirals. You can't treat it with antibiotics. So it's basically rest, drink a lot of vitamin C, stay hydrated, and stay away from everyone else. Let's just say you do need to go out, try to frame that, or let's just say you want to go supermarket. If you want to go to the supermarket and get food, wear gloves, wear a mask, protect yourself from the virus, and you protect other people because you don't know who has it, and you might not, and you could have it. So why I'm saying like wearing gloves and wearing masks, it's droplets. It's airborne, but it's from droplets. So when someone sneezes within 6 feet or 2 meters, depending on where you guys are listening from, the respiratory droplets can go into your lungs, your nasal cavities, or someone can sneeze on the doorknob. Let's just say you touch it and then you touch your face, like I just did then. But
Right.
before we went into this show, we watched our hands, and that's another thing. Sing happy birthday twice, going front and back in between your fingers, about anywhere 30 seconds to a minute. Yeah, it could be it's
Yeah.
up to some people, but it's like necessary. Like
Yeah, well, it's an easy way to calculate 20 seconds because some people count fast, some people count slow,
yeah,
whatever. Like Happy Birthday always has the
one
same
Mississippi,
tempo,
two
so
Mississippi.
yeah, yeah. Going back to what you were saying about like how it can be transferred by people sneezing and coughing and whatnot. I heard that it even just goes through talking, because these droplets are so small.
Yeah, it could be just
And that's
if you're within 6 feet, like less than 6 feet, then yeah, from talking, because like some people do spit when they're talking, and some of those droplets
yeah,
comes out. It could be really small.
yeah.
So like some like other preventions that you could do, like covering your mouth, your nose, your elbows, or a tissue. Avoid touching your eyes, nose, mouth. Clean, disinfect, and like I work in a lab setting, so like before I work in the hood, I use bleach, water, and 70% ethanol, and that's basically every single thing I use when dealing with the coronavirus. So I do.
Bleach and
Hmm?
bleach and ethanol. Damn.
Yeah. So it's basically just because you don't want. So like as I'm working in the lab, I do clinical tests on seeing who has it and who doesn't have it.
Hmm.
So basically, I need to clean the hood from any pre-existing, if anything didn't clean or any infection is in there, or any viruses. Let's wipe that out, and then protecting from each patient if they have it or not, so I don't cross-contaminate
Right, right, right.
and give
Yeah, I
out
mean,
a
tell us more
lot.
about like how your job has been kind of like taken over more or less kind of by this whole COVID-19 situation?
So right now, I've been working in a lab in the Northeast region, and they are taking it head on, and it's kind of well known right now, Northwell Health. They are attacking it head on. So what we are doing, we are using this machine called Panther Eye. And a lot of people won't know what Panther Eye is, which is fine. It's a machine that actually tests for the antibodies, not the PCR, so the RNA in the virus. So PCR is poly chain reaction. So what it does is kind of like has a pick, like a little snip pick of the RNA of the virus, and basically with the humans like DNA, kind of like we have a license that goes into a license buffer to kind of like degrade the DNA into RNA and kind of matches. If it matches, positive. If it's not, so if it's positive, it will amplify it, make more of that RNA that's replicated with COVID-19. And there's because it needs a certain amount of to like be like, okay, it's really positive, or it's not positive, it's negative.
Right, like we know for sure by the gene sequencing or by the snippet of RNA that this is the COVID-19 strain.
Yes, and then as right now we are doing validations. It has to be cleared by the FDA, CDC, and all that stuff to be. But we are working on trying to detect antibodies in humans, so they have it.
When you say cleared, do you mean?
So it needs to go through a process of the machine can pick up the positive antibodies and the machine can pick up the negative. Because if it just pops out of nowhere, they'll just say 5. Okay, what's 5 mean? 5 is positive, 5 is negative. Like, what is that?
Right.
So they're trying to prove that this machine can find the antibodies for the people who has COVID-19, or let's just say you're a silence carrier, but then you have antibodies because you're not showing the symptoms. So let's say present, okay, and then the next step is some in labs, clinical labs, or research studies trying to see the antibodies and mass produce the antibodies.
Right. You said that both the FDA and the CDC have to audit the machine.
I'm saying the CDC more.
Right. That's what I was thinking.
FDA is anything with drugs, or not drugs, or anything with food and drugs and healthcare industry. They always have to like audit to see everything is going well, and we're not.
I thought it would be mainly CDC, right? Because it's Center for Disease Control. Right?
Yeah, but right now CDC is involved because of the pandemic.
Okay. All right.
So besides that, you have like traveling. There's certain places already have travel bans, and as well as like masks. Like a lot of people are making like cloth mask, or trying to like mimic another non-medical cloth mask to be used for public. Because surgical masks and N95 masks, respirators are in short supply, and they are mostly reserved for healthcare workers. So when you do go outside, try to if you don't have a mask, bandana works. Just anything that you can wrap around, a scarf, anything you can wrap around. But after you go outside, when you go back home, put it into a bag. If you don't have a washing machine, or if you do have a washing machine, put it in. Put all the clothes that you have stripped down, put it all into the wash, and then start that day, and then start it up. I think that's every time you go outside, or you think that it's contact with COVID, because now it's not just affecting old people, it's affecting younger people too, and the numbers are rising. And it's nothing to sleep on. But besides like the symptoms and all that stuff, Evan, I know you're in Japan. How is it over there?
Yeah, so Japan is kind of an interesting case. I would say an outlier, especially when you look at what's going on with coronavirus in most of Europe, places like Germany, Italy, and France, and of course New York. And we can get into New York after I cover Japan a bit, but Japan has only seen maybe a little over 3,000 cases, I want to say, by now. I might be wrong on those numbers, but we're going to have links in the show notes to COVID-19 trackers that you can check the live numbers. But basically, so yeah, the first confirmed case came to Japan in like January 21st. And then shortly after that, we had the Diamond Princess, which was like a cruise ship where somebody who had been tested positive for coronavirus had gotten off of the cruise ship on February 1st, so pretty much at the end of January. And the ship was quarantined, once it arrived in Japan in February. And a lot of people were like, the Japanese population was like, no, we're not letting those people off, obviously, not without extreme testing and making sure that they tried to reduce the number of people who got infected and quarantining the people who are already infected. So 700 people on board that ship actually ended up getting infected. And I think this is like a personal observation, but I think maybe the Japanese government was using, and even health officials were using the ship as a way to understand the virus in a small population, right? Because they could observe it without it getting out into the general population, where there would be more likely to miss cases, especially cases where people are asymptomatic. Or they would misdiagnose it. There's all kinds of things that could happen. But
when you have 3,000, or it's like 700, however you want to use it, compared to tens of thousands, it's for the common good.
Right. Yeah. So it was a good opportunity for them to really observe the virus in a confined environment. And they found that 18% of all the people infected on the ship by the end of February had no symptoms of the disease. So that's a fifth. That's almost a fifth of people who have no symptoms and are just walking around like there's no issue. And then later on in February, there was a scare on the news where people were saying like some toilet paper is being like shipped to us from China, so buy up all the toilet paper you can buy right now so that you don't get coronavirus infected toilet paper. It's such a kind of hilarious / dumb story, but because of that, everybody started panic buying, right? And you couldn't get toilet paper for like a week or so. Luckily for me personally, like I live very close to the supermarket, so I was able to go in the morning and get what I needed. But a lot of these supermarkets we're only offering maximum like 2 per person. I'm not saying rolls, I'm saying like 2 packs, right? So if you got like a pack, you got more than 2 packs, it would be like, hey, you got to put that back because other people need to buy toilet paper too, which is makes sense.
New York is the same right now.
Oh, okay. Yeah, and the same thing with masks too. Masks have been sold out for a while. They recently sold them again, but we missed that. So unfortunately, we don't have masks. We have masks, just not like a new batch of them.
Yeah.
So then, I don't know. Weeks and weeks progressed, and when you see Italy and New York and other places get worse and worse and worse, Tokyo just kind of like here and there, a little bit. Some cases popping up. There was suspicion of, Japan hiding the amount of actual cases because they didn't want to have to postpone the Tokyo Olympics, which as of right now, it's already been postponed to 2021. But at the time, late February, early March, they were trying to make sure that infections didn't go any higher, so that they could continue to host the games.
Yeah.
And some people were saying like, doctors might be putting the cause of death on the death certificate as pneumonia, not specifically as COVID-19, right? But again, that's all speculation. So
yeah,
that is what it is. But I don't know. I think it's worth considering and thinking about. So in the second half of last month, Tokyo started having these like semi-weekly government briefings to the general populace. So people were listening to the news late at night, and you could see it on like any TV channel. And the governor of Tokyo, Yuriko Koike, she would appear and make announcements like uh, basically in Japanese law, as it was at the time, and even now, actually, they can't actually enforce a lockdown, at least not in the way that it's being done in New York. Um, and they can't tell people like you can't go outside and you can't go wherever you want, and then use legal authority to stop them. You can't really do that. It's not illegal. So yeah, it's just kind of like a request on the government part saying, hey, please don't go outside because it's going to result in more cases. But there's no punishment. It's not illegal, whatever. And then she made this like announcement of the Tokyo Olympics being postponed for the next year.
Gotcha.
So far, even from how do you say personal experience, I guess, anecdotal experience, yeah. I went for a walk the other day, and I saw that people were in the park, like watching the soccer leaves, and like playing sports, hanging out with their kids and their families, and blah 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 blah. And it just seemed like an average day for everyone.
Yeah.
Maybe there were more people using masks, but it seems like not much had changed. The city didn't seem as deserted. At least, well, if you compare it to New York, it's very, very
like I feel like it's
extreme.
You need to go outside, get some fresh air. It's always good. Like keep your distance from others. But like I can see people getting stir crazy and being like, I'm in the house cooped up for the whole day.
Yeah.
Let's do something different. Let's change it up. Yeah, now you can't go to like restaurants like in New York or like in the US. Certain states are it's different, but in New York in the suburbs, like you can't sit down in a restaurant. If you want to get food outside your house, you have to order, pick it up, or delivery.
Right.
And then after that, you kind of wipe it down. Depends on how much of the extra step you're willing to take. Groceries are certain stuff are limited, like toilet paper, essentials are like limited to like one or two per person.
Yeah.
So,
I wanted to ask like about in New York, like are they how strictly is everybody following the declaration of like a lockdown? Because from what I saw in the news, like 94% of people are doing that, social isolation and staying at home in Italy. But in Tokyo, only 63% so far have actually been doing that. And this is based on a study done by Google. They were analyzing, cell phone data. In New York, is it like, let's say like the city and also the suburbs? Because I'm hearing also that Long Island is growing in its cases.
Yeah, well, yeah, because the lab is in Long Island and they're doing a lot of testing, so probably both Suffolk and Nassau County are growing. The city is growing. Certain people are like NYPDs. They go out patrols just to break up social gatherings. They have broken up before, but it's not like to the T and be like, oh, okay, like guys, disperse, ladies, like everyone, like please, like you can't be like less than 6 feet apart. It is kind of enforced, but also it's not to the point that it's like you will be arrested if not compliant.
Or like hit with sticks or like
Yeah,
Duterte in Philippines.
it's kind of like please move around, please disperse, go to another place, spread apart, and kind of like have that in vocal enforcement. Just at the moment, being like, hey, New York as a whole, depends on where you are, it's more affected than others. Like New York, I know people, friends, families that are not in the city anymore, and they went back home in their like the suburban life. Yeah, it's a little bit different, but now they're quarantined in their own house, staying home with people that they know that don't have it.
Yeah, my brother too. He even
Some
moved out of his
mortgages,
apartment.
not some mortgage. I know the government released that stimulus check that's coming in soon. The 1,200. You make less than 75K a year, and you have to just report your taxes from 2018 or 2019. So that's another. That's cool. That's nice for the government. Yeah, it's not much, but it helps. It depends on what degree how you're looking at it. That's a month's supplies of food or whatever the case may be. If you're paying that much as well, but you get what I'm saying. But where I'm going at with New York, it's coming. The peak. A lot of people are saying like about Easter time in a week or two. I can see it being a little bit later on, the end of April. Just because on the numbers hasn't starting like to curve or start flattening. I know a lot of people are saying flatten the curve.
Yeah.
So the tests have become more available. It's easier to the public. So if everyone's going to get tested, the number's only going to go up, and then is how we divide and conquer after that. Italy now, their numbers are either stabilizing or declining. So that's also a really good sign because we are, when I say we, New York are following the same number as Italy. And the problem with Italy, they had this open door policy. So when people were coming in from trips, traveling, whatever, and they'd say hello, they hug, they kiss their loved ones, friends, family, and kind of like turn into this whole pandemic and really isolation crazy mode. Everyone's home for the month that I heard about. Like, so in Italy, they had this like holiday for a month that people like doesn't work. For the most part, they don't work, they stay home.
When was this holiday?
It's called Ferragosto. It's in August. So basically, this whole month, people just stay in, like kind of like a 1 month vacation you get. Besides, like essential workers, like you kind of like still work, but not. It's not as crazy. Like you have your hospital with people, healthcare people, food like supermarkets.
Yeah.
But mostly you're home relaxing. Now instead of being in August, now it's in April because it's still the pandemic is still going on. But like certain places, like in Italy and Germany, France, they're all in now. Spain, and that's in the numbers of confirmed cases. Spain exceeded Italy, and Italy was the number one for a while, for a last week.
Yeah.
Now it's USA, Spain, Italy, and it all depends on how everything's going to be and what they're going to do. New York, I feel like they're doing the right things, splitting up the ventilator. They had to split the ventilators into two now, making all colleges in the New York City into their hospitals, kind of like triage places for people who hasn't, trying to combine them in one place and trying to help them as much as they can. As well as besides, like since I'm working in a lab, like there's other pharmaceutical companies working on vaccines and treatment. And people are like, oh, why they're working so much? It's like, well, they have to, plus they're having a number. So certain phases that they have, it's like phase 0, phase 1, phase 2, phase 3, phase 4, all depends on how many people you could get in a trial. And if you hit that, if it shows improvement and not harmful to the patients. So like Johnson Johnson's have a vaccine, but it's phase 0. So like they're only able to test about 20 to 50 people, and not even 50, about 20, trying to see if the drug has some sort of like minimal effect, or it's not like harmful.
Right.
Then phase 1 that you have with others like CanSino Bio, they have a vaccine, so that they are testing about 20 to 50 now. So like now people are getting the one that's in the lead as right. When I say in the lead, they have a treatment going on and called Glead, and it's phase 3. So phase 3 is now is in the hundreds and thousands of people that they are testing. And now they're trying to compare the new treatment to the standard treatment. And it's pretty randomized, like no one knows who's going to get it, and you could get this placebo or not. But this is trying to have the fact, and this is now they're fast tracking because now so many people are available that they are saying yes to these treatments because there's no sense of treatment yet besides rest and vitamin C, staying home, isolation, drink a lot and fluids. So, and a lot of people are saying that before ibuprofen, don't use it because it manifests at first. Now, not a lot of people saying what I'm saying, just stay with Tylenol if you don't want the headaches. Tylenol is way better, I feel like personally, and as well as the headaches, the fever, that's what mostly that will help you with. And certain people, if you're allergic to it, take aspirin don't take Tylenol. Take something else. If you're allergic to Tylenol, the main thing is your health. So what? Getting back to the whole thing, kind of wrapping it up after, like the lab works, they are really really good. Evan, do you have any like sites that people have for people can follow the virus spread and see what's going on?
Yeah. So, I mean, I'm not going to be able to say it on the podcast because honestly, they're too long for people to even, know them just by the URL name. But I'll share them in the show notes. There's the WHO has actually put out a live updating dashboard for people to track COVID-19 confirmed cases and a number of deaths and then recovery cases as well. Microsoft also developed their own proprietary dashboard. Although when I was looking at the numbers side by side, it looks like the source data might be the same. So maybe it'll just be like your personal preference on how you want to view it. And then if we're looking at Japan specifically, there is a website, www.stopcovid19.jp, where people can see not really graphs, but more of the numbers of cases throughout each prefecture in Japan.
I really like the first one, ArcGIS. I really do like that one a lot. It's from like John Hopkins. The numbers are pretty accurate, and then shows
John Hopkins
81 countries that has it, and like really hit the million confirmed cases. So I really do enjoy that. People are like kind of like number freaks. That's really cool to look at, and refreshes. You get to refresh, but it updates about every hour or so. Cool, and shows you like different cases, confirmed cases, death, recovery, what country, and then each country has like certain dots. If you go to America, it's like certain counties as well. Wow. If you like kind of like zoom in, they show you like different counties. Yeah. Pretty cool.
Okay. Yeah, I have to mess around a little bit with it more. I was fiddling around with it before the episode, but
it's the ArcGIS.
I'm sure there's a lot more I can find out about it.
Other two, but one thing like before we get off, I do want to say this one thing. Thank you for all whoever's listening right now. Thank you to all the nurses, doctors, healthcare professionals, research and laboratory fields. Just thank you and salute you. Like you are the real heroes. Like everyone thinks about.
Yeah, seriously.
And Batman are the heroes. Like now this is like every day. And now this is pandemic mode, panic mode, and you are the ones that are going in head first, without a doubt. Yeah, we all know everyone's scared, but you are still going in, and that's what matters.
Yeah, it's real. It's real life and death, and we really appreciate all that our healthcare workers and first responders are doing, because I'm seeing cases on news where people are recovering, and honestly, it's not just because they're doing all the clinical work, they're doing the testing, they're giving them treatment and intubation in some cases, but also genuinely caring for the patient. And this one guy was talking about how because of that, he felt like they gave him strength to carry on through it, and he recovered, and he was able to go home to his wife and his 5-month-old twin daughters. you know, and it's like stories like that that just, you know,
and
makes you really appreciate all that they do
in the field, like especially seeing like like nurses, doctors, seeing them face to face, and they probably have seen a lot of losses. It's always good to win. It always gives them the drive to see the next one and pushes everyone else's. But yeah, like we salute you. Thank you for your service.
Yeah. Again, thank you.
Just want to conclude. Thank you guys for listening to this week episode on coronavirus. We're gonna see how this feels and hopefully go back at it again next week. To see.
Yeah, I think we might explore it.
It's very good. It's very, very good in the sense of like this topic because on how informative this should be to people around the world, especially that alarming 63% in Japan.
Yeah. I mean, it's just, you know, people don't feel the sense of crisis that they should because of what's going on in New York, you know, and Italy and other places.
Yeah.
But hey, we'll see. And if things get really, really bad, listeners, you all know because we will do another episode.
Guys, you can follow us on Training Brains on our Facebook page, Twitter, Instagram. If you have any comments, concern, you can send us an email, trainingbrainspodcast@gmail.com. Send a comment.
All included in the show notes.
All included in the description below. If you guys have comment, concern, let us know, good or bad. If you want us to add something on top of this one, we will. You want to we're gonna listen about this one especially. But besides that, we'll see you next week and stay safe, be safe, and take care.
Yeah, take care, stay safe, and stay sane. Bye-bye, everybody.